and dark urine, we call the condition as being jaundiced. Some of you may have heard of jaundice. Some of you may not heard of jaundice. So today we're going to look into what it means, what causes it, and how do we handle it. Okay. All right. Now let's move on to our first slide. So this is the outline of my talk. We're going to be looking at what is jaundice, why does it happen, how do you treat this condition, and how do you prevent this condition. All right. Let's move on to the next slide. Now, what is jaundice? It is a condition when the skin and the white of your eye, if you can see here, the white of your eye becomes yellow. That is called jaundice. All right. And together with that, is everything okay? I got a message asking me to share my video.
No, actually, want to see your face.
Oh,
love to see
I see.
But
right.
When you share content, actually, yeah, it will turn off your video. They cannot see your face.
Sorry,
I want to see a handsome face, doctor.
I didn't realize that. Sorry about that, guys. All right, so
yeah,
I hope you guys can.
Guys, all right.
Okay.
Yeah, you see a photo, still can see the doctor handsome face.
That's right. Agreed. You need to see my face. Me too. I wish I can see your faces too, but I can't. I can only see Ben's face.
Yeah.
All right. So yeah. So when the white of the eye becomes yellow, then we call that jaundice. And usually that is associated with the urine becoming yellow too. Okay. So when you pee, the urine will become dark yellow. Together with that, your stool becomes pale. Okay. So your color of the poop becomes very like clay color. All right. So usually with the yellowness of the eye, your pee becomes dark yellow, or maybe tea colored, we call it, and the poop becomes pale colored. By definition, jaundice is when the bilirubin is more than 40. The normal bilirubin in our blood is 20. So jaundice is caused by high bilirubin. So the next question is, what is bilirubin, isn't it? That's what you guys are wondering, right? Okay, now we know what jaundice means. We know what is the definition of it. Now let's look at what this whole thing is all about. So how is bilirubin produced? We know when the bilirubin is high, you become yellow. So bilirubin is actually from the red blood cell. In science, we call it hemoglobin. Okay, so this is a picture of the red blood cell. When the red blood cell is broken in the liver, it's broken into two components. One we call heme, another one is globin. As the name states, yeah, hemoglobin, right? So this is the protein part of it. This is the pigment part of it. The pigment is what gives the red blood cell its color. All right. So the hemoglobin is broken into heme and globin. And the heme component is further broken down by the liver into bilirubin. Okay. So bilirubin comes from the red blood cell. And the bilirubin, 10% of it will go in the urine. The other 80% of it will go in the stool. And another 10% will be reabsorbed. So what gives you the urine, the color it is the urobilinogen. And what gives the poop, the brown color, is the stercobilin, which is actually a byproduct of the bilirubin. All right. So now if you're wondering why is your poop brown in color, it's because of the bilirubin that's been metabolized by the bacteria. All right. So now you understand what bilirubin is all about. And you know when that's high, that causes jaundice. All right. What are the body parts that usually we look for this yellow discoloration? Number one, the eyes. Number two, underneath your tongue. Number three, the skin. You can see here, this is the hand of a normal person. This is a hand of someone who has jaundice. All right. Now, this is a diagram of the various colors of your stool that you can have in your lifetime. Yeah? If it's black, that means you're bleeding from the tummy. If it's red, that means you're bleeding from the bottom. If it's green, that means you have some infection. Brown is normal. So in someone with jaundice, usually the stool will be this color, pale. I hope all of you have had your lunch. Okay, this may not be very pleasant, but this is how a pale colored stool will look like in somebody with jaundice. Okay. Now, what about the urine? Okay, so this is normal urine. This is tea-colored urine. It looks like tea, you know. So this happens in someone with jaundice. Okay. All right. Now let's move on to the next level. Yeah. Why does jaundice happen? Okay. Now I took a simple diagram here to explain this situation. I'm pretty sure all of us know what this means. Yeah. This is the toll gate. Yeah. This is before Chinese New Year holidays. Okay. As you can see, there's a massive traffic jam before the toll gate and after the toll gate. Okay. So the same logic can be used in explaining why the bilirubin can go up. Okay. So imagine the toll gate as being your liver. Okay. So if there's a lot of cars are going to the toll gate, then there can be congestion, right? So the same thing. If there's a lot of bilirubin going to the liver, then there'll be congestion. So bilirubin can go up. Or if there's a problem at the toll gate, meaning to say problem in the liver, bilirubin can go up. So the problem that happens before the liver, we call pre-hepatic. Hepatic means liver, yeah? So before the liver problems. There could be problems in the liver too. And if let's say there's an accident here, okay, after the toll gate, there's an accident, there'll be traffic jam too, right? So if there is a problem after the liver, the bilirubin will go up. So in simple terms, it could be before the liver problems, in the liver problems, and after the liver problems. Okay. This is one way of how you can make the traffic flow better, right? I hope this system comes to Malaysia soon. Yeah? You no need toll gate anymore. You just have to scan your cars, you know, and I mean your tag, and then you can just move without having to pay the toll. All right. So the same way we use this concept in treating patients with jaundice. We relieve the obstruction so that the bilirubin will drop. All right. Before talking about bilirubin, you need to understand the normal anatomy. Okay, this is a very basic anatomy of the structures involved in bilirubin metabolism. Number one, the liver. The big structure in red is the liver. And from that, can you see these two green tubes? They come out from the liver and they communicate with this bag, small bag here we call the gallbladder. And then the tube continues smoothly into the duodenum. Duodenum means a small bowel, yeah? All right. So this is one important structure. The liver produces the bilirubin. Then the bilirubin goes into the gallbladder. The gallbladder keeps it there and squeezes the bilirubin out when it's needed. Another important thing you need to understand, the bile duct, the common bile duct here, the tube that brings the bilirubin, communicates with this duct, which is a very important duct we call the pancreatic duct. So this is the pancreas. The structure that looks like a hockey stick here is the pancreas. So you have the pancreatic duct here, and it communicates with the bile duct, and both of them forms a common tract and drain into the small bowel. This understanding is important for us to figure out why somebody has jaundice. All right. Now, this is how the bile flows. Remember, I told you just now the toll gate. So the liver is like the toll gate, yeah? So the liver produces the bile, okay? The bile from the liver tissue follows this green tube you call bile duct into the gallbladder. When you eat food, this yellow arrow is food, yeah? When you eat food, food is digested, it goes into the small bowel, then the bile from the gallbladder flows into the small bowel. So that is the normal flow of bile. So if there is a blockage in any one of these levels, or there is damage, that can cause your bilirubin to go up. So as I said just now, damage that happens before the liver, damage that happens in the liver, damage that happens after the liver, that means into this tube, all of these can cause the bilirubin to go up, and hence one becoming yellow. All right. So I hope this is very simple. This is as simple as I could imagine to relay the message. Yeah. Okay. Now, these are all the causes before the liver, in the liver, after the liver, that can lead to somebody to have raised bilirubin that can cause the person to have jaundice. Okay. So this is before the liver. That means anything to do with the red blood cells. This is in the liver. You may have heard of the hepatitis viruses, right? Hepatitis A, hepatitis B, hepatitis C, and then those who take a lot of alcohol, unnecessary medication, weight loss drugs, all these can cause problems in the liver, okay? But today, our focus is not this. Our focus is just after the liver problems. So what are after the liver problems that we need to pay attention to? Number one, stones in the bile duct. Number two, cancers within the bile duct and pancreas. So in more detail, this picture tells us all the causes after the liver. We call post-hepatic jaundice, or in simple word, we say obstructive jaundice. All right. So these are all the causes of obstructive jaundice that is possible, that can cause the bile not to flow, that causes the bilirubin to go up, that causes someone to have jaundice. All right. To simplify this, I put it in this table. The one on the left are all the cancerous causes. The ones on the right are the non-cancerous causes. There are so many, right? But today, our focus is going to be these two on the left, which is pancreatic cancer, and cholangiocarcinoma is bile duct cancer. That is from the cancer category. From the non-cancer category, we're just going to talk about gallstones. That's all. We're not going to talk about the rest of it today. Otherwise, you guys going to be with me until tomorrow morning. All right. So we don't want that. All right. We want you to go home shortly. All right. Now, so these are the three commonest problems, as I was telling. Number one, gallstone. Number two, pancreatic cancer. Number three, bile duct cancer. So if you look at gallstones, this is the gallbladder. This is the gallbladder. So if there is a stone in the gallbladder, the stone can fall into the bile duct and it can block the bile duct. So the blockage will be anywhere along this line, and that can cause jaundice. Number two, pancreatic cancer. Cancer in the pancreas here. Can you see this? So we know the pancreatic duct and the bile duct are close to each other. So if there is a cancer here, the cancer will block the bile duct as well, causing obstruction to flow. And finally, bile duct cancer. If there's a cancer within the bile duct, the blockage can be anywhere along the bile duct, causing disruption to bile flow and making the person to be yellow. All right. Now, what are the symptoms? All right. First, your eyes become yellow, and then your skin become yellow. You start vomiting. You start becoming nauseous. You become unwell. Then you notice your urine becomes dark, and your poop becomes more less brown. Yeah, becomes more pale. You start having abdominal pain. Some of us will have diarrhea, and mainly the cancerous problem, you start losing weight. Yeah, and when the jaundice becomes more, the skin starts itching. For those with cancers, abdomen may swell up, and some of them may have fever, especially if you have stones within the gallbladder. All right, so these are some of the common symptoms. Yeah, what are the risk factors? Being overweight is a risk factor. Eating a lot of fatty food and low fiber food is a risk factor. Having prolonged diabetes is a risk factor for developing pancreatic cancer. If you have family history of gallstones, then you may have higher risk of developing gallstones. Generally, females who are more than 40, who are overweight, have higher risk of developing gallstones. Smoking tobacco products and taking excessive alcohol can lead to pancreatic cancer. Previous pancreatic inflammation, or we call pancreatitis, can lead to cancer. And finally, being exposed to industrial chemicals like hydrocarbons, benzenes, and certain dye in certain industries can lead to pancreatic cancers. So these are some of the risk factors that can lead to cancers of the pancreas and the bile duct. Now, next level, how do we manage this condition? All right. So number one, how do we investigate this problem? Number two, how do we treat this problem? All right. So if someone comes to us with these symptoms, which is yellow eyes, dark urine, pale stool, we straight do some basic investigation. We do blood tests. We look at mainly the cancer markers and the liver function. We look at the urine. So this will give us a rough clue as to what's happening. All right. So we also test for viral hepatitis and those kind of relevant tests. Once we have a rough idea what's happening, then we go on to the next level, which is an imaging. We can do an ultrasound or CT scan, MRI, or even a PET CT to figure out what's the actual problem. Eventually, we do a scope. It could be a simple upper scope or a more advanced scope called ERCP and EUS, which I'll explain later, to actually find out what the actual problem is. So these are all the things that we do to find out what is the actual cause for the jaundice so that we can treat the patient. Now, this is an example of a CT scan. On the left here is the CT scan of a normal person. Here is the liver. This is the spine. Sorry, just give me a second. Okay, so this is the liver, this is the kidney, this is the spine, and this is how a normal pancreas looks like. Okay, so if you look at this picture here, this is a pancreatic tumor. This is how a pancreatic tumor looks like. Can you see this black, well circumscribed lesion, which I've marked with the yellow circle? All right, so that's pancreatic cancer. So now we know, oh, something is not right in the pancreas. That's the cause of the jaundice in this patient. But how do you take a sample? This is not good enough to start treatment, right? So next is biopsy. This is where this technology called endoscopic ultrasound is useful. We call it EUS. So pancreatic cancer biopsy with endoscopic ultrasound, EUS. So this is the special scope. This is a scope which has a camera at the tip, has an ultrasound probe at the tip, and it has a needle. It is all three functions for me to look at what's a problematic sample. So this is, when I use this technology, I have an ultrasound view and I have camera view. So I can see inside the stomach and I can see structures behind the stomach, like pancreas is behind the stomach. So once I've done with that, I go there and I take a sample from the pancreas. And this is how it looks like. This is a pancreatic tumor. And this is the needle that I use to take the sample from the pancreas so that I confirm it is a pancreatic cancer before I decide what needs to be done. So next, how do we treat these conditions that lead to jaundice? The fundamental principle of treatment is to remove the underlying cause. If it's a gallstone, remove the stones. If it's a pancreatic cancer, resect the cancer. If it's a bile duct cancer, you resect the cancer. It sounds simple, but it's not as simple as that. Yeah? Okay, now let's talk about removing stones, yeah, with ERCP. All right. So ERCP stands for endoscopic retrograde cholangiopancreatography. It's a long name. Basically, what we do is we put this scope here into the stomach, into the small bowel, and it's a special scope in the sense that it has a side window. Can you see the side window here? All right. So with this scope, we go into the bile duct. We try to detect the stone and we remove the stone. So this is how it is. Okay, so we remove the stone, we throw away the stone. With that, the stone in the bile duct will be taken out. So the problem will be solved. Yeah. All right. So that is called ERCP. That's one method to remove the stones from the bile duct. But eventually, we have to remove the gallbladder. Yeah. So that we have to do a surgery. All right. So my job is to do the scope to remove the stone from the bile duct. So let's talk about pancreatic cancer now. Pancreatic cancer, there can be curative and another one called palliative. If you pick it up early, then we aim for curative. When you pick it up late, you have to aim for palliative. Unfortunately, most of pancreatic cancers are picked up late. Yeah. So for instance, can you see this mass here? That is the cancer. All right. So in order to give a curative resection, they have to cut this whole segment of the pancreatic cancer in the small bowel with the gallbladder, and they connect the rest of the systems together. This is a major surgery. It's called Whipple surgery. It's only done in big centers. Okay, this is done if we think we can cure the cancer in pancreatic cancer. If we can't cure the cancer, then we have to aim for what we call palliative treatment. Again, we use ERCP and we put in a metal stent into the area that's blocked. Remember, I showed you the traffic light, the toll gateway just now. You have to free up the road, right? The same thing. We put these stents here. These are made from metal, special metal that allows us to place them where the cancer is causing a blockage. Like this, we put the stent here so that the bile will flow. And how this is done? Through the same method just now called ERCP. And this is how the stent looks like jutting into the small bowel. All right, so this is palliative. All right, so with this, the yellow color of the patient's skin and eye will start coming down, and the liver will start functioning better. But this is just a temporary measure. Yeah, you have to start chemotherapy, radiotherapy, and everything else to downsize the tumor. What about bile duct cancers? The curative approach will be to resect part of the tumor or part of the liver that's involved in the cancer. All right. And if you think you can't give curative treatment, you aim for palliative treatment. The same method, we use the ERCP scope. Then we put in this metal stents inside to overcome the obstruction. If you put 2 metal stents, it seems like this. If you put 1 metal stent, this is how it will be. Okay, the same principle, you bypass the obstruction so that the bile can flow. All right, so my last topic in the outline just now, how do you prevent this condition? Number 1, regular screening. Number 2, lead a healthy lifestyle. So what is regular screening? Go for your yearly blood screens, go for simple ultrasounds yearly. Every 5 years once, do your CT scan. Every 10 years once, do your endoscopy. So all this starts at the age of 40, yeah? All right, so you should do this on a regular basis. Number 2, lead a healthy lifestyle. Take care of your meals. Do exercise 3 times a week at least. Reduce high fatty food. Try to reduce all the junk food and everything that has all unnecessary flavorings and colorings. If you're smoking, it's good to stop. Take alcohol in moderation. And if you are working in certain industries that has certain cancer producing substances, you have to be careful to protect yourself, yeah? Like dye industries or petrochemical industries. And in some parts of the world, like northern Thailand, they like to eat a lot of raw seafood that has this parasite called liver fluke that is known to cause bile duct cancer. So you have to be careful when you're in these areas, yeah? All right, so with that, my second last slide, the conclusion. Jaundice requires urgent medical attention. It's usually associated with pale stool and dark urine. It may come from benign or malignant condition. To determine the cause is important so that we can treat the underlying cause and solve the problem. Take home message, ladies and gentlemen, if you have symptoms of jaundice with dark urine, yellow skin, pale stool, consult our gastroenterologist. In this case, it can be me. This is my website. This is my QR code. Feel free to scan. If you have any problems, you can get through the liaison people in Beacon, or even get to us directly through our clinics, nurses in the clinics. With that, I thank you so much for your attention. Now we are open for questions.
Yes, everyone, you may drop your questions in our chat box. So I will ask Doctor on behalf of you guys, yeah? But at the same time, scan the QR code, all right? Actually, Doctor, I didn't realize. I thought today's topic will be quite light, like yellow eyes, dark urine. I thought like just a simple problem. It like seems like jaundice end up like so serious, the whole thing. I was quite surprised. I see all the pictures.
You see, Ben, I decided to choose the more serious one. Sometimes jaundice can be as simple as you see, in babies you have a different kind of jaundice, yeah. Whereas in adults you have a different kind of jaundice. So in adults, jaundice always warrants investigation. You cannot take it simply. But again, majority of time is due to some medication or some things like dengue. You can have a bit of jaundice too, or Medicaid. What do you call that? Hepatitis A. You know. So these are more common now. But I decided to choose the more serious subject. You know.
Okay. Thanks for sharing. Actually, it's good because I thought a lot of people, I think they were just like, seems like quite not so serious. They take it too easy, like yellow eye, maybe like not enough sleep, that's why yellow eye.
Oh, no, not at all.
like not enough dehydrated, that's why become yellow eye.
Of course, there's another reason. Some people who take a lot of beetroot or a lot of carrot,
yeah,
the eyes can become yellow. But that's different now, you know. So we're not looking at that, huh?
But Doctor, may I ask you questions?
Sure.
Actually, like those serious cases, like those pancreatic cancer, actually it can be quite draggy, right? The whole treatment, it like can goes up to a few years to get done or get cured, something like that, is it?
Yeah,
commonly happen like that way or not so common happen that way?
Ben, first of all, my video has disappeared. I don't know why. So
Just I saw your face, but now suddenly you disappeared.
yeah, I didn't do anything, you know. Okay, start sharing my video. Okay, good. All right. Okay. All right. So yeah, sorry, Ben, your question was, can you repeat the question again?
Yeah, those pancreatic cancer,
Mm.
can it be very, normally is it very draggy? It can drag a few years to get it done, or actually can be like straightforward, either like your curative way, cut and connect, that's all, and then get done, or like not so simple, cut and connect, but end up still not done, and still have to do a lot of follow-up treatments end of the day.
It all depends on when you pick up the tumor. If you
I
pick it up
see.
at an early stage, then it's like cut and paste lah. Okay. All right. But
Okay.
again, the surgery is a major surgery. There can be a lot of complications during the surgery and after the surgery. The recovery may take few years lah, you know. Okay. The recovery may take few years. But having said that, it's not a walk in the park lah. It's a lot of work. But that is if you even if you pick it up early, the outcome will be good. But there's a lot of effort. If you pick it up late, then it's a torturous journey lah. So you will end up, you know, you may get a surgery done. You may have the disease coming back. You need to get chemotherapy. There'll be a lot of pain involved, you know. So it's really a difficult journey lah. Not only for the patients, the family members, everybody around, you know. So yeah, it's not a simple thing.
Yeah. But actually, I can see Beacons, they are best in curing cancer, right? They got already all the equipments, got more than 100 beds in hospitals. But I checked your website there. So I think you guys are quite ready to, because I think a lot of parts, actually, you see, suddenly yellow eye become jaundice, end up can be like pancreatic cancer. So which is, we got a lot of body parts, a lot of small symptoms can end up quite serious, become a cancer, right?
Correct. You see, Ben, I would say Beacon is not good in curing cancer. They are good in managing cancer.
Oh, all right. That's very important. That's very important.
So I don't know whether we can cure all the patients or not. You know, sometimes cancer is a difficult problem, but Beacon is definitely good in managing it. I can tell you that much. There are good people here who can manage from the beginning up to the end of the disease or the patient, you know, because cancer, there's a lot of, if not curative, then palliative, you know, you have to look into both aspects. Like, it's not only curing. Yeah. So yeah,
so Beacon is well equipped. Beacon also provide palliative, those treatments for long run to support the patients and families, right?
Oh, very much, very much.
Oh, all right. Okay. That's important. That's important.
That's right.
All right. Okay. Okay. Let's see. Any questions from the floor? Okay, here, okay, from Lisa, probably, Carmen. Okay, you're asking, will taking synthetic supplements long-term, such as vitamin C, etc., lead to liver damage? How about Chinese herbs, okay, Chinese herbs or medicines, will lead to liver damage? Will taking liver tonic such as milk tristel effective to maintain healthy liver? Who is recommended to take liver tonic? But now start to worry about tonic, these ladies.
Okay, not only ladies, I think everyone for that matter.
Okay.
Okay,
yeah.
now, so the principle of this milk thistle has a silymarin compound in it. You know? So basically, the right thing for a healthy liver is a healthy lifestyle. Okay, so the biggest problem now that we face in our region is fatty liver. So many of them have, you know, because of unhealthy lifestyle, insulin resistance, we start developing fatty liver. So the right thing to do, as I say, is healthy lifestyle. On top of that, if you develop fatty liver, then there's a role for silymarin. Okay. All right. But if you do not develop fatty liver, so you think just by taking silymarin is going to help you to prevent fatty liver, I'm afraid the answer is no lah. You know, so you have to have a healthy lifestyle. Then with that, if your liver is good, then you don't need any supplements. All right. But if you develop fatty liver, then yes, it's warranted to take silymarin. And the next question, Chinese herbal medication. Yes, I won't vouch for it. Some of it may be good, some of it may not be good. So the question is, does the person who give you the medication know what's in the medication?
Oh yeah. Those are all a lot of ingredients.
Yeah.
They put in
So
a pot and then boil it
yeah.
together.
So we need to ask the person who's giving it what's in the medication. Then only you need to come and see me. Once you can tell me what's inside it, then I can tell you it's safe or not safe for the liver. So if he himself doesn't know, you don't know, I don't know, then I can't comment whether it's safe or not safe. But usually Chinese medication has a fair bit of steroids in it. So that will end up causing stomach ulcers and end up causing adrenal suppression. Yeah. But some of them may be good. So I'm not the right person to comment about the safety without knowing what's actually inside it. And then the third question was the supplements like vitamin C and everything. Long run, no, it won't damage your liver if it's taken in the right dosage. Most of them are excreted in the kidneys. Okay.
Yeah, overdosage is also no good. Whatever like good thing supplements that end up overdose also like because other things happen. Yeah, true. Okay, I got a Facebook live questions from Mary. So you're asking any other supplement untuk HEPA? HEPA. HEPA. HEPA.
HEPA means liver. Okay.
Liver.
So again, as I said, you don't need supplements if you're leading a healthy lifestyle. If you have fatty liver, then you can go on anything that has silymarin in it. So silymarin is the right compound that can keep fatty liver at check.
Okay, good. Okay, here another one from Vivian, who has consistent higher level of bilirubin be concerned? Should those who has consistent higher level of bilirubin be concerned? Okay, which means those that having the bilirubin level most of the time is quite high one. Should they be always concerned? Should be like always need to go check whether what the cause of it.
Okay, I'm not sure what exactly she means, but I assume what she means is that some of us can naturally have slightly higher than normal bilirubin. Okay, so that's normal. As long as your bilirubin is high in the absence of high liver enzymes. That means if only your bilirubin is high, but your liver enzymes are normal, that you don't have to worry. That's called a Gilbert syndrome. It's a condition where most of us, or some of us are born with this condition, where you can't bring the bilirubin into the liver for it to be thrown out of the body. So the bilirubin will float in the blood a little bit, causing the bilirubin level to be higher than normal. So it's called Gilbert syndrome. So if your bilirubin is marginally raised with the liver enzymes being normal, I suggest you see a gastroenterologist, make sure there's nothing is wrong with the liver, then you don't have to worry about it anymore. So I think that's what she's referring to.
Okay, true. Yeah. So I think the ladies encountered the same issue before, so probably will ask these questions. Okay, now I will ask, hey, is there any difference with newborn jaundice? Actually, newborn jaundice, I'm also curious. Is it considered pre-hepatic or post or whatever?
Wow, you're using the right terms, Ben. I'm happy. I have imparted the knowledge.
I learned a lot. Just now.
Okay, good. So it makes a lot of difference when you share knowledge. People catch up very fast. Okay, so in children, in neonatal jaundice is pre-hepatic jaundice.
Okay.
All right. Whatever we spoke about just now was post-hepatic. So in children, the red blood cells are not mature, so they break down a lot faster than usual. So that causes neonatal jaundice. So that treatment you put under the sun and everything, so that photosensitive light and everything. That's totally different from adult jaundice.
No wonder. My daughter that time got jaundice. Then the doctor make sure the stools no problem, the urine got no problems. So then that will be like pre-hepatic situation. Nothing to do with liver anymore. Okay, got it. Thank you very much. Okay, here another is the spider nevi was one of the most common symptoms in the liver disease from Noel.
Okay, it's not the most common, but it does happen. It happens mainly in people who have prolonged liver disease. We call chronic liver disease because the failure to metabolize estrogen is a particular hormone. So that causes these small capillaries to dilate and become more obvious. But it's not the commonest. You don't really find it in everybody with liver disease.
Okay, not a common one, huh? Okay, glad to hear that.
But you do
So
find
now,
it. You do find it.
Oh, okay, good. Okay, from Doris here, what is the ratio that a diabetic person can develop liver cancer when they consume medications and insulin for long term, like 20 to 30 years? Or this is something more on the liver things, sir?
No evidence.
No evidence, sir.
No evidence
proof
that,
here,
that intake of insulin will increase the chances of liver cancer. No. But diabetics inherently has 3 times higher chance of getting pancreatic cancer. That's
pancreatic,
because
not the liver.
not the liver. That's because of the nature of the diabetes itself.
Oh, okay. Now I see. Okay. A lot of time people thought that it will damage the liver first. And now it's damage the pancreas first.
Because diabetes is due to pancreatic damage, right?
Yeah.
Because pancreas is not working so well. That's why you have diabetes, right? So whatever ongoing damage that's happening in the pancreas is probably the reason for the pancreatic cancer.
Okay, got it. Learn it today. All right. Okay, this is a question from Facebook, one from Prima. Doctor, kalau makan ubat hormon ada HEPA. Hormon ada HEPA. Okay, ubat hormone. I think asking about if the hormone pills will damage the HEPA.
Liver, yeah. Yes, possible. Sometimes certain hormones, especially you call OCPs, oral contraceptive pills, where the estrogen and progesterone content is very high, you can develop some lesions in the liver. But this most of the time are not cancerous. They are not dangerous. They're benign lesions. Yeah. So yeah, they can have such, they call focal nodular hyperplasia. So it's a particular change in the liver can happen with certain hormonal tablets. But short of that, I don't know if any other hormone that can cause outright liver damage.
Okay, glad to hear that. Because I think the hormone issue is also quite common nowadays for the females. They're used to have these issues.
Again, there are many hormonal tablets, so some may cause, I'm not sure, but the commonest used hormone is OCP, oral contraceptive pill. Yes, it can lead to some liver-related changes, but that doesn't mean you cannot eat. You have to weigh the risk and benefit. If the benefit really outweighs the risk, then you should take the tablet or the hormonal tablets.
Yeah, true. Okay, any more questions from the floor? Okay, seems like everyone quite overwhelmed with your information today, doctor. So actually I learned a lot from you two today.
Yeah, post-hepatic, pre-hepatic, wow.
Initially, because I'm in the insurance line, so we've been talking about all kind of illness for quite some time. So I know the surface part, but the inner part, what will be happening, actually I got no ideas. But now I see quite a different levels of things kind of happens.
Honestly, if you ask me, you guys are very important because most of the clients, right, don't come to doctors first. They ask here first, right? Hey, I have this problem. Recommend a doctor. So your database of clientele is so huge. So it's good that you guys be informed first so that you can give them the right advice.
Yes. Thank you for educating us also. Thank you for your time today, Dr.
No problem.
Rogers. So for those who stay back, I got some special candies for you guys. So I will share with you. So doctor, thank you for your time.
Okay.
Thank
you so much.
Today is very beneficiary for us.
No problem.
And then thank you.
All right, take care everyone. Bye-bye.
All right, take care. Bye, doctor.
Bye.
All right. So I would like to share the information on this part, guys. All right, thanks for saying back. Okay, so this some things good to share with you guys. Is provided by us, VG and partners. So as we all know about, Dr. just now shared with us, don't even look down on a small little jaundice. It can cause quite a great things. So doctor been shared us with a lot of treatments way, curative or palliative also can. But however, all these things you have to go admit hospital. As where you want to see a doctor, Rajesh again, you have to go to bigger hospital. Then, as we all know, the medical fees been inflating from years to years. So if you worry about inflation, let me share with you how a medical coverage plan that we can provide you guys can up to 50 millions a year limit, all right? As just only cost you 5 ringgit per day, all right? So you can take care of all kind of cancer. We have a cancer precision medicines to help you guys to do a genetic test and focus on the cancer to settle that part. And we can also cover for 11 maternity complications. For ladies, we cover maternity complication also. And unlimited days, which means if it becomes so serious, you have to be hospitalized for 1 full year. You also no worry because we can cover all the rooms charges or ICU charges for 1 full year, no problem. But good things here is if you have not made any claim for this 1 whole year, we will reward you up to 1,000 per year allowances for you to do any medical checkups, or you want to do some diagnosis tests, a CT scan on yourself, also no problem. These are no claim benefits for you guys. And then guarantee every year the limits will increase, all right? So if you guys want to know more about all this, how it works out, so scan the QR code right down here for the voucher rebate, all right? Today only, you guys scan it, and then you fill up the form information. We will get someone to connect with you, and then we'll share you that what you guys would like to know more about. Then when you guys really would go forward to the applications, then there's a voucher rebate for you guys application, only for today's. So scan it now, and then don't miss a chance. Although you guys might not want it, it's still okay. You scan it, get to know about it. All right. If not sign up, it's still okay. But this voucher just only for today's. So thank you for your staying back with us. And then I'm going to turn on my camera now. Thank you very much. And remember, scan the QR. All right. Thank you guys. Bye. Thanks for the afternoon. And I think you guys will benefit a lot from our Dr. Rajas. All right. See you guys soon. Bye.